You need to see doctors and nurses. It's everywhere, everywhere, everybody ran, even on the ward, patients that were sick. They ran for their life. They ran away. Like that is I know we're joking
it's
about
so barbaric.
It's horrible.
Yeah.
Imagine, like, why are you beating healthcare workers?
They caught one doctor, the nurses. They always pretend as if they could not jump. They were jumping from first floor onto the ground floor. They were jumping for their life. And this right is for you to know that every healthcare professionals are bound by it to provide you the healthcare service. And if whoever is not abiding by it is going against the law and they can be prosecuted.
Nobody should deny you access to emergency care.
Yes.
Because of money or because of anything else.
So if they deny, it is not the word deny, it is the word referral or being passed on.
Yes, that's the second word to take away. Referral. Even as an healthcare worker, another healthcare worker, I'm not supposed to tell them about your medical condition if they are not directly involved in your care. If you tell them that it's dead, they will beat all of us.
They could even kill.
Don't let them beat all of us, because if you know that man, they will beat all of them. Before we go into that, we'll firstly play a video for you to watch. Then we'll use the video as a point of reference to everything
we're going to discuss here.
See you.
Hi everyone, welcome to another episode on our podcast. Okay, for everyone who has watched the last episode on the misconception, so we are so grateful. I hope you left comment. I hope it was something you could relate to or that you could learn from. And then, of course, my name is Oyinda.
And I remain Taiwo.
So on this Vital Science podcast episode, remember we said we're going to talk about the right of the patient. Yep. And then this is something we've come back to discuss with the people.
Yep.
So, all right. Do you want to start and then take us round?
Yes. Today we are going to talk about something in Nigeria called the Bills of Rights.
Yeah.
It was, I think it was implemented into law around 2015, 2016 time.
Yeah.
And it was introduced by the Federal Competition and Consumer Protection Commission and the Federal Ministry of Health.
Yeah.
And this Bills of Rights involves everything that in the healthcare system. So before we go into that, we'll firstly play a video for you to watch. Then we'll use the video as a point of reference to everything
we're going to discuss here.
See you.
I spent almost 8 to 9 hours at the hospital. They packed medicine for me. I was like, you see me that I will drink this thing. Even when I got home from the hospital and I wanted to drink the drug, my husband was like, do you know what that drug does? I said, no. Do you know what this one does? I said, and you want to pack everything and drink it? I was like, they gave me at the hospital, now ignorant me. Me. My husband had to start Googling everything. He said, this one is for headache. Did you complain of headache? Take that one away. This one is if you have worm in your stomach. Did they tell you have worm in your stomach? Take that one away. So we need to be extra vigilant. We can't just hospitals will give you any drug just so if you whatever drug they give you does not cure the sickness, you have to come back and pay another extra money. They are trying to use you to basta. I won't fear genuinely. Then they use it they chop. So you need to be careful. Once you are giving even at the pharmacy at the hospital, you need to ask them, what does this one do? What does this one do? Not just they will tell you take 2 in the morning, take 2 in the night, 2. Like a mumumi, you put 2, pack all the medicine and take home. So my husband was very careful to know what each drug does, and he was able to tell me the particular ones I needed to take. And as you see me, I'm fine, ill and hearty. The moral of this story is, now Nigeria we dey. Learn to be very vocal. There is no such thing as a patient's dog eats the fattest boy in Nigeria. They will kill you. They will kill you anyhow. You need to learn to be vocal. You need to learn to let people know when you are dissatisfied with their services, especially if you are paying money.
Okay, you're welcome back, everyone.
Hello.
I mean, the video is something, I mean, that was shown to me by Taiwo. I actually never came across it. And then, although I've come across similar things in the past where people would talk about the healthcare system, the healthcare providers, as if we don't know what we do. I mean, well, that is all part of the misconception.
It's not today.
Yeah, but not today. We want to talk about, we want to educate and advocate people as we've always done today.
Yeah.
This is not to tell people that this is wrong or right.
Yeah.
So, I mean, the first patient bill of rights.
Yeah.
Maybe we should jump into that.
Yeah. So the first is right to access care. Every patient has the right to receive medical attention, regardless of gender, religion, ethnicity, or financial status. No one should be denied emergency treatment because of money.
And this is broadening on the public health factor of accessibility, and of course affordability, and then availability. Just 3 factors. So when we go to the factors, I mean, there are some parameters discussed on the public health system in Nigeria. So I mean, this keeps going on, and it breaks heart when people go online to talk about patients being rejected in hospitals because of money.
Rejected.
That word, they said rejected. And then when you ask them because why, even before you ask, you already know what an average Nigerian will tell you. Oh, they rejected them because they said they don't have bed space. But the number one factor is always about money, money, money. They said we should go and deposit money first. Number one to say is it is totally wrong. I think we have to also accept the fact that we might have been the factor that caused people to have this idea, because something must have given before people believe that this can only be the reason. But in recent years, I do believe that this is not solely the cause, but because this is something that people have been brought up with, or that they have been fed within the society. So we don't even think of any other reason that could have made people to have been rejected.
Do you know where that happens mostly?
I mean, our tertiary
Nollywood.
Oh yes,
Nollywood is the main culprit.
That is why I said like injected into people that we've been brought up, because many of us are households, we watch Nollywood growing up. So that knowledge is like ingrained into our brain that people are rejected. It's not the word rejected.
But do you think there's some truth to it?
Well, yes, but then the word is not rejection. So in healthcare system, when you go to a private hospital clinic or you go to an healthcare center, or for example, you go to a secondary level of care like Adeoyo or Lagos State hospital, there is the Lagos State, LASUT, and there is the LUTH, which is the university teaching, which is the law government, the federal government owned. There's a difference when they cannot care for something as LASUT.
No. Before we talk about referral, I'm just talking about now there's a law that says you shouldn't reject someone in an emergency because they don't have money.
They have to provide emergency care first.
Yeah, but there are times you see most tertiary hospitals, they don't do this because they are government owned. They try as much as not possible not to do this. Most times the money they ask them for is money for consumables, because
they're not being provided with it.
These consumables are not available.
Or people complain that, when we get to the hospital, they are telling us to go and do registration. How else would they know the identity of the person you brought if you don't do registration?
Yeah.
It is a given. Even in the Western world, you do registration first. Well, in Nigeria, there is no database, but in the Western world, you do registration so they can have an idea of your patient history. Do you have an allergy? Do you have a DNAR? Do not attempt resuscitation for somebody that do not want to be resuscitated if it is something that could lead to death. Those things. So, I mean, taking into account when people think, all these things are being asked, they're not being asked as frivolities or because we are so cruel and cold-hearted that we just want everybody coming into the system to just die.
Yeah.
No.
It's just some things are not available. The government did not provide.
And this right is for you to know that every healthcare professionals are bound by it to provide you the healthcare service. And if whoever is not abiding by it is going against the law, and they can be prosecuted.
Exactly.
They can be. This is why we want you to know your right and to empower you today. Yeah.
Yeah. And the second part you were talking about was the referral part.
Yeah.
And I think there was this example or this scenario that happened recently of the young
the vibrant
journalists,
and lovely journalists of Arise News.
that died, that on the news, a professional
God
journalist
rest her
made,
soul.
amen, a professional journalist made these erroneous comments,
Yeah.
and which I think is something that should
Have
be
been taken
corrected.
up by even the healthcare, the
Yes,
Ministry of Health itself.
and would like if maybe peradventure, if the person herself, if she could educate herself or re-educate herself about what it means when they reject someone. They didn't really reject the person. You were
They
talking about
refer.
referral, and you're about to explain what the importance of
Referral.
in the healthcare system.
Thank you for that. Because the thing is, I mean, in our previous episodes, so many of them, but there was one particular one where we talked about the public health sector design. So there's something we called, again, the primary healthcare system, the secondary healthcare system, and the last one, which is the tertiary healthcare system. So we would liken all these things to our primary school or the kindergarten, the secondary school for the secondary tertiary for the secondary healthcare system, and finally the universities or the NCs or the polytechnics as the source of tertiary healthcare system. You know, you can't jump one to the other. You can't become a doctor without going to the university, and you can't go to the university without having been to a tertiary secondary school first and obtaining your WAEC or your NECO result. This is how the things work. You don't expect somebody to be given the certificate of being a doctorate or doctora in a secondary school. This is entirely out of the, I mean, jurisdiction of the secondary school. They would definitely pass you. I'll use the word pass on. Maybe in the nearest future, when people want to talk, they will not say reject. They would rather use the word pass on. You are being passed on from one healthcare system onto the higher one that they believe could look after you better, because they have the resources, they have the personnel, they have the knowledge, and they have the capacity to look after you. If you are going into a healthcare center, that in our previous episode, we even talked about many of them, if not all of them, not working weekends. So now you get there, you meet the gate man or one nurse who is there for the night shift, because they put somebody to man the facility, and they pass you on, and you say you are rejected. What would one nurse do? What would they do? Let us be rational about these things when we talk about them. You go to a secondary school, but like LASUT, we know LASUT is big. LASUT is very popular and populous. They have enough staff, but do they have the right staff? You go there, they see somebody head lacerated almost into half. What we mostly look at in this place is mostly pregnant women, and people with chronic medical condition. Anything surgery is Luth. Go to Luth. And you say, oh, LASUT has rejected us. No, you are being passed on. That is what referral is all about. Referral is a system or mechanism where you are just being passed on from the least or mediary or intermediary level of care to the highest, the next higher one, with the right resources, the right healthcare, the right personnel, and the right capacity. I mean, they want you to be safe. This is why you are being passed on. Whoever wants you to die, they will keep you on and after look after you. They would collect their money nonetheless.
Yes, they would.
They'll collect their money, and then, I mean, something terrible would eventually happen to your loved one. And it is because of this empathy of, we also have, how do I describe this? We also have opinions. We also have, I don't know how to describe it, that, I mean, well, when you think we are cold-hearted, we are not. We are warm-blooded, just like you. We can always pass you on. We don't want to be judged by a decision, whether by a God or by the people. Do you think it is easy to be dragged every time online? I mean, you're just the lesser devil. Maybe we should move on to the next.
Just to say, most tertiary institutions, the way you recognizing that this is a tertiary institution. Most times you see university in their name. They always have university.
Absolutely.
Like University College Hospital Ibadan, University College Hospital Ilorin.
And the state would have state in there.
Yes. And in the case of LASUT, it's tertiary. It's tertiary. Because it's called university. And FMC are also tertiary.
They are, and if they don't have university in them, they have federal for the tertiaries.
To make them tertiary. And just keep it. one thing, if there's one thing you take away from this first point, is nobody should deny you access to emergency care.
Yes.
Because of money or because of anything else.
So if they deny, it is not the word deny, it is the word
Referral.
referral,
Yeah.
or being passed on.
Yes, that's the second word to take away. Referral. We use it a lot. You could, like I said, the journalist that made that comment on live national television.
Yeah. And then just before we moved on, I'm sorry to cut it short, Taiwo. You know, remember this lady recently, pregnant woman with twin pregnancy, that the fetus died in utero.
Yeah.
I mean, the babies, they died while she was still pregnant. And then people were like, these people are so wicked. Why they passed? They did not even attend to her, or they just said she should go to another place that they don't have bed space. That is referral. Now, one thing is, sometimes we know our people. When you tell people, please go away, they want to beg as if it is, we are not just taking them out of our own volition. No, it's not so. So now healthcare professionals, they've time and time over times, they've come across things like this, scenario like this. This is why they've made it a point where they are harsh at people. They're like, they want you to leave, they tell you harshly so that you can register it in your mind.
Not harshly,
let's use the word assertively. So they are being assertive. The word is being assertive. They are like, they tell you with a sentence that you would understand and grab at once. Because when people are in frustration, they are just after their own well-being. Nothing enters. So they tell you in a tone that you can listen to. So people at home who are not in the same emotional distress as the people in this scenario, they think, oh, they are being wicked towards these people. It's not being wickedness. It's far from it. Nobody wants you to die. I mean, everybody, these are women. We know how crucial it is, moment of pregnancy and delivery, childbirth for women. So why would you be sent away? And if anybody does this as something they enjoy, then they are narcissists, and they can even be a killer. So I mean, and then the lady went to another hospital and they said she should go and register. Another thing that we said, registration is a norm. Because you've not had any antenatal care with them. How do they want to identify you?
Yeah.
And they said after registration, so wicked, they said there is no bed space. Of course, this is outside of their control. Before you came back, there are people waiting. Maybe somebody had chanced the bed space that was meant for you.
That's true.
So,
yeah. Please just try to educate yourself. I know healthcare workers have got a lot of things to put up with, and the healthcare, like we always say, the healthcare system in Nigeria
is porous.
And it needs to be declared as a state of emergency.
Absolutely.
They need to declare state of emergency on the healthcare system in Nigeria and have an open heart surgery on some other on some areas that needs open heart surgery immediately. The second Bill of Rights is right to information. You have the right to know your diagnosis, treatment options, the risk or benefits involved in simple language, in simple, clear language. You must be told what is happening with your health.
I think we should relate this to the video we watched.
Yeah, definitely.
Because the lady said, and my husband said, they gave me so many medications. Do you even know what they do? And she said, no. In that situation, I am not blaming the healthcare professionals. I would blame you as a person. People gave you medication to go and swallow at home, and you did not ask them, even if they themselves ignoramously, because it is their right to explain to you, not even your right. It is their own right to explain what that medication is meant for. They did not explain to you, and you took them home to go and take. Why would you do that? You have every right for you to ask your healthcare professionals. If a doctor would not explain to you, maybe speak to the pharmacist. They can explain better to you. You want to chip in something?
I mean, what I'll say is like we said, the healthcare system in Nigeria is so porous, and in this kind of scenario, there's no way a doctor that is having a conversation with you, like this right says, they have right to information. If you make a diagnosis for a patient, you have to explain to them what the diagnosis is in simple, clear terms.
Absolutely.
And you have to tell them the treatment options, what the treatment does. And after giving them treatment options, if you prescribe a medication, you tell them the mode of action of the drug, the rationale behind you. Oh, maybe this person has got an headache or they've got high blood pressure. This is why I'm giving you this type of high blood pressure. If it's a beta blocker or calcium channel blocker, this is the reason why I'm giving you this type of, because antihypertensives are different
They're
classes.
different classes, yes.
So this is the reason why I'm all antibiotics. Like,
yeah.
I'm not going to go into abuse of antibiotics, but if a doctor or healthcare provider prescribes out to you, it's got different classes. There's different generations of antibiotics. So this is the reason why I'm prescribing you broad spectrum antibiotics, or this is why I'm providing the second generation antibiotics. This is why. Give them the simple, clear terms. If that's not done, I know there are laws to that, but there are no systems to enforce these laws, and which cause the patient like ignorantly saying without asking, because most people don't know they have rights. Like we said, the rights. This is the reason why I'm giving. Why did you give me this? What's my diagnosis?
And if anybody is rude to you when you ask those questions, I mean, that is very dangerous.
Run for your life.
And you should be actually wary of the kind of certificate they carry around.
Exactly.
A doctor should be able to defend what medications they are giving you or what line of treatment they've prescribed.
Yes.
And the nurse who is going to choke you that injection or give you that IV medication should be able to tell you what it does. Not, oh, it is to flush it away from your system. Flush waiting.
WC. Is it WC? It's not funny, but I don't know what they're flushing. Yeah, so that's for that. On that part, you have the right to ask.
Absolutely.
What you should take away, you have the right to ask. Anything that's going into your system, you have the right to ask. The third right is right to informed consent. This informed consent we're actually like talking about in the pre-production meeting about. We want to talk about informed consent as an episode on its own, whereby we elaborate. But here we'll just like talk about it briefly. So if you want to learn more about informed consent, turn on the notifications.
But people should know that, I mean, what informed consent is. Basically, you want to do any treatment, not necessarily surgery.
Yeah.
If as small as injection is, if you want to take injection, you have to be told you want to take injection and you have to accept. This is after you've known all the informations about what this medication is for, what this treatment is for. And you have to be able to know what could be the resultant factor of taking them, side effect, adverse effect, all those things. So you have the right to know everything entailed in any kind of treatment you want to take or receive.
So like you said, before any procedure, surgery, or test, your doctor must explain and get your permission, except in life-threatening emergencies. So if there's no consent and before
there's no witness to do second person consent. In healthcare workers, we have the Bill of Rights to take the consent upon ourselves to,
if it's going to save your life,
do the best thing for the patient in that situation.
Just so you know, there are two types of consent. There's implied consent and there's written consent. There are some consent that you have to sign, like maybe you are going for a surgery or an interventional procedure, or maybe interventional treatment. You have to sign that you accept it, and there are some ones that it will be explained to you, then you have to say yes, I want it.
Such as in case of maybe the injection we talked about, or your dad, we've tried the ceftriaxone antibiotics, it's not working, and we think we should try augmentin. Do you think this is something we should do? And you said yes. That is your implied given consent.
And there are sometimes that maybe you're unable to talk. If I probably want to give you injection, and I'm like, this is the injection, I explain what the drug is for, and how it's going to work. And the next thing you do is remove your trouser for me to put it on your...
You've given your consent.
That's also implied consent. So moving on to the fourth one, the right to privacy and confidentiality. Your medical information is private. Healthcare workers can't share your details without your consent unless required by law.
If you see any nurse, we carry camera, ring light on TikTok, on Instagram, and they say, oh, I came across one patient today or a relative, blah, 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 blah. And they've given accurately every information of what you came across, what you discussed, or what you experienced when you came across them. They can actually be sued, even
if they mention their name.
If they mention your name, if confidentiality is not maintained, or if they gave information that can be traced back to you or the patient. That is a breach of confidentiality. They can't be sued for that. They can't be called into judgment for that.
Another example is maybe you came for HIV testing, and it was discovered that the person had HIV positive. The next thing we ask is always after the what do you call it now? The talk after the counseling and all.
Yeah.
Then they ask, would you like us to inform, or would you tell your partner? And that scenario, you can't. There's nothing you can do as an healthcare worker. There's nothing you can do if they say they don't want to tell their partner.
You can't.
You can't, as an healthcare worker, decide to go and tell their partner.
That is a breach of privacy.
Yes, so you could sue people when it comes to that. Nobody should even.
And if they find it difficult in Nigeria to sue, if you think it is going to take long, they can report them to their guiding body,
council, yeah,
like the Nursing and Midwifery Council for the nurses, or the Medical Association for the doctors, or the Dental Associations for the dentists. Medical and dental. So yeah, we can.
You can't, and also it's not even to your partner or your relative, like you divulge your, maybe if you are sick, I can't go and be telling your wife if you don't want me to tell, or I'll be telling, even as an healthcare worker, another healthcare worker, I'm not supposed to tell them about your medical condition if they are not directly involved in your care.
Yeah.
So that's that. One thing you need to know is your privacy, is that privacy and confidentiality is important during your care. If you don't tell them to do something and they do it, the person, and they are liable. The fifth one is right to dignity and respect. Patients should be treated with compassion, respect, and without discrimination. No insult or no stigma, whether you are rich and poor.
This is why we say in the past episode where we were talking about nurses being rude or being letting out their frustrations.
Yeah.
So we were trained to take in and then to stomach frustrations and insult, even though they may be something we come across quite often. And then even though we said people should treat us better, in the same stretch or breath, we actually did admonish and we warned our colleagues and ourselves that we needed to do better by being compassionate, by being enthusiastic to people. People are not, hospital is not a place where people want to be. I mean, that's a good thing. People would always be in the hospital, but it's a place nobody wants to be. It's a place where emotions and everything is tested. So, I mean, we should do our best and then try as much as possible to put people in the best mind and then state as much as is possible. Yeah. So I think this is part of the qualities we were trained as while in school on.
Yeah.
So, and then even until now, when you like apply for job or when you do your revalidation as a registered practicing nurse, it is still there. I am enthusiastic. I am this, I am that. We still use the word enthusiastic. We still use the word empathetic, because this is what we want to be described as. Pharmacists also, they need to be empathetic. The doctors, they need to be empathetic. We don't need to carry cold shoulders around our patient. We need to deposit our personal problems outside of the hospital wall before we enter.
Just
because
like any
we know
job.
This is what we sign for. We know that. I mean, we are there to cater to people. This is not a job where you don't interact with people. Any job that involves interacting with people, it also entails you being the patient as much as you can be.
Yeah, that's very well. That was very well put.
Thank you.
And that's that about the fifth Bill of Rights. And just to add, as much as you deserve respect and dignity, the healthcare worker also deserve that. So if you don't show, it goes both ways for everyone to be.
It's a covalent bonding relationship.
Chemistry things. The sixth one is right to complain and receive feedback. You can report misconduct, negligence, or poor treatment and expect a response. Every facility must have a complaint process. Like, I'm not gonna lie, when I was in Nigeria training, I've never heard where they were asking for feedbacks about, like, it was strange to me when I came to the UK. It was really strange to me that I went to the hospital for just one day. I think maybe something happened to my finger, or it was just a slight something.
Yeah, they asked for how the staff treated you.
Then I go back home and they sent a letter via post, and they also sent an email that I should give them a feedback that they're very much interested in my feedback. I was like, ooh.
Private hospitals actually do that.
In Nigeria?
Some private, not like every private. Where I last worked, we did that. Because, I mean, that is the bane of our existence. Without the feedback, we couldn't forge ahead. But then in public hospitals that we've been talking about, so I do believe maybe that may not be in existence except for Lagos State, which may, I'm not quite sure, which may have that system. But I would say if there is none like that, people should know who is the boss. If you know a junior doctor is not doing the right thing, you report to the matron of the ward, or the junior or the consultants when they come for round.
Some patients might be scared that if they report, then their treatment will be impacted. You can never know. So that's why it should be done anonymously.
Well, if they don't want to do it directly, maybe they can just find somebody who is from another ward entirely, and then say, oh, could you report as a third person on my behalf? Say, oh, another relative that I made friendship with while we were admitted. They discussed about how poorly they were being treated. And I think as a fellow Nigerian, I should take it up. Maybe we can do that. It's just like a form of whistleblowing, kind of.
Yeah, that's why this law says every facility must have a complaint process.
Maybe we should urge our hospitals or the government to make this. If you are creating a bill, you should also create the job or the system.
What I think that they could probably take into account. Here we've got PALS, the patient, what's the A? I've forgotten what the A is. Patient liaison services, whereby the patient, if they have any complaint, they are different from the ward, the doctors. They are just staffs that deal with patient feedbacks
and complaints.
So that's what they deal with. They deal with the good feedback, the bad feedback, everything complaints. Where patients have concerns, they raise it with them rather than with the ward to protect the patient and any retribution that they might encounter. So you could probably learn that. That's something they could pick. The seventh one is right to choose or change healthcare provider. This is very important. The way you have the right to choose and change healthcare providers, the healthcare provider also has a valid right
to say I'm not giving you healthcare.
Yeah, to deny you.
And this shouldn't be based on factors like maybe racism, tribalism, or religious belief. I mean,
is it the healthcare
the right
denying?
To,
Oh yeah, you have the right to choose your doctor, nurse, hospital, or seek second opinion.
So it should be on genuine and cogent reasons of professionalism, reasons that are broad on professionalism, not people like, oh, because they don't practice the same faith as I am, I'm not going to treat them.
Well, there's another side to that. Like there's some power of Muslim sect whereby they can't say a man. So that's another side to it.
Which is right, but not because what I meant.
You said valid.
We don't practice the same religion, and then you will not see me. It's not. That is entirely absurd. I mean, reasons like that. This is privacy. So this is privacy matter for whoever does not want a male or to see their nakedness or their most private part, which is very cogent. It's privacy. We've talked about it that should be respected.
Yeah, if someone is being mean to you though.
On the privacy matter that we talked about, which I forgot to mention, I'm so sorry to take us back, but this is very important. I saw a video of a woman that said she's had given birth to 2 children. She was on her 3rd pregnancy. And she went for antenatal, and the doctor said, oh, now I've done the fetal check. Now I have to do your breast examination. And she was like, oh, that's so he was trying to harass me, a male doctor for that matter. Number one thing, I think in the last 2 pregnancies, if they did not do the breast examination, then the qualifications of those doctors that saw you, all of them, and the midwives should be questioned, because it is very, very right for them to do your breast examination. They have to check if you have any deformity to your breast before you give birth and start to give birth. Any retracted nipple or inverted nipple or no nipple at all. So, or engorged nipple. Those things, they need to be checked every antenatal visit. That they did not do it in the past 2 pregnancies were absolutely not right. So now where it is not right was for the doctor. Informed consent that we talked about. He should have told you before he did that not just jumping from one procedure into the next.
Did
Just
he?
like,
But he said, "Oh, I need to check your breast."
but he should have been told before, not assume that a patient knows what they are here for.
Oh
You want to
yeah,
start a
explain it
total
fully.
procedure. Oh, Mrs. So, I want to see you today to do your antenatal
Yeah.
visit. These are the things we have to do. We progress from the vita check to your breast exam. You know entirely what is going to happen throughout, not just jumped into it middle of the
And he could
procedure.
have probably handled it better,
Exactly.
like during
And
before.
another thing is, if a male doctor is saying you, not minding anybody's religion, if you are opposite sex, a female colleague has to be present as chaperone when he wants to do that kind of an intimate thing. That the doctor did not have a chaperone was highly, highly unprofessional and very incorrect. So now, the lady, because she was ignorant of the situation, I believe this is a time where the lady or the patient should have asked why. We say again that you have the right information. Ask, why do you want to do it? They've not done it in the previous pregnancy. Why do you want to do it? Why is your own different? Social media is not a place where you learn. It's a place where people give diverse opinions and they just want gist. People just want to laugh. People just want to, like, dump their miseries on others.
Yeah.
So, ask. If you had asked, if that lady had asked why you wanted to do it, she would have learned a new thing on why that was important and that why it was incorrect that they were not done in the previous pregnancies.
Yeah, most definitely.
Yeah.
I should always ask. Then moving on to the next part is right to emergency care. In life-threatening situations, every healthcare facility must provide stabilizing treatment before asking for payment. No money, no treatment is illegal during emergencies. Like we said,
Again, no.
it's illegal. If anybody denies you, I know there are times it does happen. If they
Yeah.
deny you that, you have the right to sue them because they are breaching the law of the Federal Republic
If
of
you cancel, maybe you take
Nigeria.
it to social media. But then be very sure that it is not rejection. It is being passed on or being referred.
Yeah,
Please.
even during referral, you should at least do first aid care. Like if they bring a gunshot, even if you can't treat a gunshot.
There was a day I was the nurse in charge in one private clinic I worked as a fresh graduate from nursing studies, and they brought this health injury. My motorbike, a road traffic accident. Oh my goodness. It was bleeding from orifices everywhere. I took this patient in and I stabilized, gave first aid treatment. But my actually then boss, because she was the owner of the hospital, said, "Sister, thank God the situation was arrested. Oh, but then this is not somebody you should have taken. It was a serious case. You should have referred them immediately." But what went through my mind during that period was, where is the next tertiary institution? It was miles and miles and miles away. Before they get there, I was very sure that guy would have died. But do you know my joy? They came back to tell us that I survived it. And this is why I'm saying this today. Even though we have the right to refer, when you know you have the capacity to stabilize, at least give the emergency care. Please.
Kunduz for you. Kunduz for you. Yeah, so no money, no treatment is illegal. And this should be promoted. All these, the entertainment industry, they should be promoted in their movies too.
Absolutely.
Correct.
Nollywood.
Everybody should
Stop
do
saying
better.
we reject every time. We don't reject, we refer, Joe.
Yeah. Then the next one is right to a clear explanation of cost. You should know how much your treatment will cost and why. Transparency builds trust. So you should, if they say, "Oh, we are giving you this drug, this is the reason why you have to do this chest scan, you have to do this X-ray. This is the reason." If there's really no cogent reason for doing X-ray, they're just trying to rack up your bills or increase the amount you pay. That's not building transparency and trust. That's just trying to defraud you, which you could take legal actions against them.
Absolutely.
Yeah. Do you have anything to add to that?
No, you summarized it.
Yeah, so the next one is right to participate in decision. You can be part of decisions about your care plan, including whether to accept or refuse treatment. Doctor guide, but you decide.
Like the first one we did in the misconception
Yeah.
part, the lovely tweet that we read about the sickle cell anemia children. Even though she knows all the risks, she is well informed.
Yeah.
She had the absolute right to say, "No, I want to give birth to this third child." It's her absolute right.
Yeah, there's really nothing you can do. You can just hope the person sees sense, see sense in
and
what they're
reason with
doing.
you.
Yeah, but
That's it.
as long as they have the mental capacity, then you can't decide for them. They have to decide by themselves.
Absolutely.
Then the last one is right to safe and quality care. Facilities must meet patient standards of hygiene, safety, and equipment. You deserve care that heals, not the one that harms. Like you know already, the hospital. If you don't know this yet, hospital is the easiest place for you to get infection. It's something called nosocomial infection, which is
Hospital acquired
acquired
infection.
infection, whereby if there's really absolutely no need for you to be in the hospital, you shouldn't be kept in the hospital for
Otherwise, you
longer
develop
than
the things that should
you
not
should not
develop.
develop. And there are times that you hear of news that, oh, this person had surgery, and they developed post op or post surgery infection, which is harming the patient and costing them more money to stay longer, which is something that should be safe. Because if you have post op infection, it's putting your life in jeopardy. It can become septic through that, and like, septic means a greater infection that is life threatening.
I don't know if the people saw the facial expression I said when you said they have the right to the appropriate facility. Facility. I mean, I don't know. This is every day they say we should be calling our government to account, calling the government to account. They don't. The government, they travel outside the country. They see how the facilities in the outside the country look like. So they know the right thing to do. Why should we be the one calling them to action every time? We've been doing that.
That kind of one.
I mean, I think they derive some kind of erection from doing that because they know exactly, because they know even if you call them to order 150 times, they would not do anything, and there is nothing they don't give a fuck, and there is nothing they would about it.
Sorry about the
so using of so it's just, I mean, we all know most of our facilities, if not all of them, are substandard. I mean, we have to be factual about this. But this is not to blame any healthcare worker or professional that it is our cause, or this is solely because of us. If the hospital is not releasing money, which is being managed by the management, and if the federal government is not calling the management to order, so why should a bloody staff be called to order or be beaten by a patient relative because of the substantiated healthcare they were being given?
That beating. That reminds me, like, healthcare workers,
you don't have bed space. And then you slap a nurse.
This one is not even about. This is not even about bed space. Like, I've seen 2-3 cases. I heard about one, and I've seen 2 happen in UCH. The first one was which one I heard about was when Lamidi Adedubu, one of the prominent Nigerian politicians, he died while he was in UCH. They brought him. I heard he slumped. Then they rushed him to UCH. Then when he got to UCH, they already knew he was dead.
It was a case of cardiac arrest. Nobody did cardiopulmonary resuscitation. I want miracle to happen.
One of our next episodes will drop the video of CPR
again, because we had the one in the past.
Yeah, and they brought him to the hospital. He was dead on arrival, DOA. And this is what I heard. Don't quote me. This is what I heard. He was brought dead on arrival. But if most of you know who this man was,
he was loved by many.
Really loved or feared. When he talks, a lot of people tremble. So if they told them that he was dead on arrival, that would have caused uproar. Then they informed. I was told the CMAC of the hospital then.
Yeah.
Informed them that don't tell them that he's dead. What you need to do is continue CPR and take me into resource where you do CPR for a while and declare him dead. Because if you tell them that he's dead, they will beat all of us.
They could even kill.
Don't let them beat all of us. Because if you know that man, they will beat all of them. There was this another man that died. I think his name was Sugar. I don't know if you remember. Ife will remember. And those of you that don't know Ife, we introduce Ife.
Ife is behind the camera.
So one of these, then they were holding elections, then they shot him during election. It was during election that they shot him. So they shot him and they brought him to the hospital. Working in A&E, I was outside A&E. The polling booth to A&E is not far at all. They brought him immediately. They knew he was dead on arrival. But like the same scenario I explained to you, that's why I've been advocating. You should treat healthcare workers with respect. You can't just beat, because if they give you terrible news, next thing you do is beat them up.
You transfer your
So
feelings.
yeah,
One that I witnessed was in oncology unit, same hospital. And then oncology now. They can be alive 1 minute and the next, they are dead. That was exactly what happened. I don't want to mention tribe. These people went to bring their tribe people.
Oh, I know,
and they
I know.
destroyed
I was
everywhere.
there. I was there in A&E that day.
This is oncology. They
Oh, this is another
everywhere.
story.
Yeah.
Imagine, like, why are you beating healthcare workers?
They caught one doctor. The nurses. They always pretend as if they could not jump. They were jumping from first floor onto the ground floor. They were jumping for their life.
This scenario, yeah, that sugar scenario. They took him to ICU after they took him, even though he was dead. On arrival, they took him to ICU and resuscitated. This another situation. It happened on, I think, the fourth floor, Southwest 3 or Southeast 3. They told them that their relative was dead. They beat the nurse with plastic chair. They beat the nurse, slapped the doctor, his glasses went away. Then they brought their patient relative from upstairs. They brought him to emergency. Immediately they got to emergency. You need to see doctors and nurses everywhere. Everywhere. Everybody ran, even on the ward. Patients that were sick,
they ran for their life.
They ran away. Like that is I know we're joking.
It's
about
so barbaric.
It's horrible.
They could have killed the patient, other patients, killed the nurses, killed doctors.
Anybody.
It's just like disruption of public peace.
Yeah, it's terrible. Everybody needs to do better. You need like the way we say, you deserve to be treated.
It is so easy for people to label and to point fingers until you have your relative as one of those nurses or doctors and you see the way they are being treated. If any of the doctors or nurses are killed, I think what happened recently in the north, was the doctor killed, or was he like he landed in A&E or so? I don't particularly remember vividly. Maybe they beat the doctor. It was a doctor. And I think another nurse who was slapped so badly that he almost lost his sight.
This is just disheartening. Someone that is trying to save your life.
Entirely out of power.
You shouldn't beat them. You should treat them with respect and dignity. Their profession literally saves life. Imagine someone saving your life and fearing for their own life.
Yeah.
That's just awful and horrible. Thankfully, I've not been a victim of.
May we never
this. Be. Yeah, it's not only in Nigeria. Let me.
It happens
it happens everywhere.
It's even worse in some other parts of developed Western world.
Yeah, I've seen. I mean, though the kind of situation that
nurses are shot. They are being they are being killed with a running car.
Yeah, it's just disheartening, man. So let's move on to the next part of this segment, whereby we just run through this. The 5 rights. No, because actually, the 8 rights.
Yeah, the video we show is all about medicine.
Yeah, so we talk about
to teach people and then to educate them on the right of medication.
Yeah. So these are the 8 rights as a healthcare worker they have to follow before giving you a drug. And this is not just for you as a patient or healthcare user. This is also for healthcare workers that they've forgotten about their training.
Of recent, in the last few years, one renowned musician died in Nigeria. Apparently, they found out that the person who gave him the medicine, because they claim it was medicine that killed him, is a quack. So again, no who is looking after you. But then if it is a registered nurse or a registered professional, doctor or anything, this is the right they follow so they don't make the mistake that could jeopardize the life of anyone, patient, relative, or themselves.
So the first rights in medication administration, 8 of them, I'll just run through them. Right patients, you must always confirm their identity, and in the hospital, they always have a wristband. So to say, you must have to check their names, their ID. Everybody, if you come to hospital, you'll be allocated an hospital number.
Check the ID against patient confirmation if it is a patient that can talk. Unless they are semi-conscious or unconscious. That is when you assume identity is correct.
Correct, with the wristband.
So they must tell you verbally that, oh, it is me.
And not just their name, you need to confirm date of birth also. And if they've got any allergies.
Yeah.
Then the next one is right drug or prescription. Double check that you've been given the exact medication. when we said during consultation.
I'm so glad. Patients that I look after here, the color of the medicine they take. It may be dicey because there are some medication, there are different brands. So it can be white for someone and yellow for another person. So there are some patients that will be like, oh, very politely, I see that my medication, this medication, which one is it? I don't recognize it. I said, oh, it is your furosemide. Oh, but then it comes in white. Oh, I'm so sorry. This is another brand because I'm so sure.
Yeah.
That also, when patients say that, it's also register some kind of cautioning in the heads of whoever is looking after you. Because I always double check. I was like, oh, let me check again. Also, it's the medication. I'm very sure. I'm very certain. If you are unsure as a healthcare professional, don't be shy, yo. Don't kill a patient out of being shy. Remove if you are not sure, and then discard.
Yeah, that's very much correct. So this this is important. When you have the consultation with the doctor, they will tell you what drug it is. Then when you go to the pharmacy to pick up your drug, just to make sure, ask them what drug it is, just to make sure you have the right drug, so that there's no mix up or look-alike names.
Yeah.
And you might actually save life because mistakes do happen. So you might be saving lives by telling them that, oh, I thought this was what was prescribed.
Yeah.
Then if they cross-check again, then they'll be like, oh, it might be a brand name or it's the same drug but different brand name.
Yeah.
So they won't be mixed up and the right drug will go to you. Then right dose. Confirm the dosage matches the doctor's order. It is safe for patient's age, weight, and condition. Check calculations carefully, especially for pediatrics and IV meds. The goal is to prevent overdosing or underdosing.
So for this is not just true for healthcare professionals to be careful. It is also for patient and relative also to be careful. You are prescribed 1 gram of paracetamol. You get home, you use 2 grams. Who prescribe it for you? If anything goes wrong, the fault is solely on you.
Yeah, and the fourth one is right routes. You must ensure that the prescription as an healthcare professional, what was prescribed. If it's IV, it should be IV that you dispense. If it's oral, it should be oral that you dispense. Never assume. You might know that, oh, this person is supposed to be IV paracetamol, oral paracetamol, and meanwhile it's IV. You already assume. You should never assume that.
Check again.
Then right time. Make sure if it's correct time. Most of you, like Ohinda said in the previous episode of kidney failure, a lot of you take 4 paracetamol. That nobody should ever take 4 paracetamol because that's overdose. 1 gram is the effective dosage.
Even if the headache is killing, still the 1 gram.
Yeah, so you should always make sure if you take 1 gram and paracetamol most times. I know they write PRN whenever necessary. If you can take paracetamol, but you should try as much as possible.
Even the PRN, pharmacists will tell you, even though it is PRN, but the minimum time interval should be like 4 hours.
Yeah, 4 to 6 hours. Yeah. So just to make sure, and people that are on antibiotics, it's important you take it at an exact time.
So that you don't abuse it.
Yeah, to make sure it's effective also. And the main goal is to ensure steady drug levels. And when you take a drug, there's a time when the drug reaches peak effectiveness, then it begins to go down. When it begins to go down, it will be when the next dose will come in to take
the effect from
the
so that there's no break in the chain of effect.
Yeah, that's how they work because most of them are chemicals. Then the 6th one is right documentation. Make sure that it's the right name of the drug, right dose, right route,
and
right
if it
time.
is in the hospital, as healthcare workers, we would always document. If you ask them later on and they tell you, oh, there's no documentation from my colleague, challenge it.
Yeah.
Because you've taken this medicine and then you were not sure. You went to ask the next nurse who is on shift because the other person has left, and they said, "Oh, I do not have a record to it." That is very, very wrong. Challenge it. You are not working with professionals.
Yeah, and this documentation helps to continuity of care and legal
prevent
protection
mistakes and errors, and then
The next one is right reason. Give the medication for the correct clinical purpose
that they are being used for.
Yeah, why is this patient getting this drug?
The lady said, I was given 7 medications. Why? Of course, maybe they are targeting different things. Your blood test woke up, came back, and then different things were seen. So each medication is targeting different things. And then maybe one medication is not going to do the work of that to control the whole ailment. So they have to give adjunct. Adjuncts are like assistant medicine or assistant drugs.
So, like Ohinda rightly said, paracetamol it's not just for headache, it's not for body pain. It's called something that helps. Maybe your body's, you've got temperature, you could use paracetamol. I'm not telling you to go and use paracetamol. I'm just saying paracetamol, what it is used for. So it's used for that. And to make sure you have a good rationale for why you're prescribing a drug, so that it aligns with the diagnosis and the usage to prevent unnecessary harms and not to harm the kidneys and the liver. Then the final is right response. After administration, observe and evaluate the patient's response. Did this medication work as expected? Were any side effect or adverse reaction noted? Follow up, assess outcomes. Just in case, like we said, allergies, we mentioned allergies previously, just to make sure the patient doesn't have an allergic reaction to the medication. When you give medication, it's not immediately you leave the patient's presence. You need to make sure you observe them for like 5-10 minutes. I know you are busy, but this thing could save the patient's life. Observe them
and see what happens when they take the medicine. And even by the bedside, even if we're not there in the room or by their bedside continually, so every time you go there, see their response. Also ask them how they feel. Have there been any changes in how they feel? I mean, in a bad or good way. Exactly. And then I think under the same thing, because some textbooks may say the risk right at 9 because the right to response. I mean, the response, this one we are just discussing, the 8th one. Also under it falls the treatment. If there's any reaction, they should give you the right treatment due to treat the reaction to the drugs that you've been given or to the treatment. So and then we've come to the end of the right of medications and then of course the right of bill. So any other thing to chip on?
Yes, I'm just going to run through the rights I was told you. We'll put it on the screen. You see on the screen as I'm reading it. The first Bill of Rights. Right to access care, right to information, right to informed consent, right to privacy and confidentiality, right to dignity and respect, right to complain and receive feedback, right to choose or change healthcare provider, right to emergency care, right to a clear explanation of cost, right to participate in decisions regarding your care, right to safe and quality care. That's the Bill of Rights.
11 of them.
Yes, 11 of them. And for the right of medication administration, we've got 8 of them, or we either added 9 of them. The first one is right to patient, the right patient, right patient, make sure it's the right patient, right drug or prescription, right dose, right route, right time, and you've got right documentation, right reason, and right response. And the final one is right to effective treatment to treat any side effect. And one of the things I think we just used to wrap up this is something I saw recently, and I was talking about a story of a family friend that they had an operation done, and it was noted that the patient continued to complain of abdominal pain. They had an abdominal surgery, and they developed an abdominal pain. They developed an abdominal pain, and the doctors, they kept doing scans and everything, x-rays and all. They couldn't find the source, and they were concerned, the family were concerned that, have you by chance forgotten anything inside this patient? And they were like, the surgery was I don't do that, I've never done that, so I didn't forget. And meanwhile, the incision site was showing pus, which is a sign of infection, and they were like, this is not normal. But the doctor kept doing wound dressing and all. So after that, the patient left the hospital, they took them home. It was after they took them home that my mom called me and asked, oh, do you know what might be wrong? This patient continued having high fever, and the incision site is bringing out pulse, and the patient is complaining of abdominal pain. Then the first thing I said was, there's something inside the patient. They forgot something inside the patient. But my mom said, oh, they said they did scan, they didn't find anything. Then the next thing I said is that you should go to a tertiary hospital to have a look. Even if they said they can't see anything on scan, there's something wrong inside.
There's no harm in opening again.
Yeah, you can't just be complaining about abdominal pain and the surgical site.
It's not healing.
It's not healing. So the person said, oh, they are tired, they don't want to go to any hospital. hospital stress is enough. And I was like, this person is going to die. If they don't die, they will become septic and die eventually. Then they said they brought in a nurse to be treating them at home and a doctor to be visiting and treating them. So when one of the days the nurse was doing wound dressing, or maybe it was the doctor, so one of them saw like a tiny, we call something sponge in theater.
Yeah.
You call something sponge. They saw like a tiny thread coming out of the wound. They actually thought it was maybe the dressing of the wound, but when they pulled on it, they saw that it was coming inside of the patient. They couldn't pull it out. So, and now the surgical site is already gaped. When you say gaped, it's opened. Like when
so the wound that is not healing will break down.
Yeah, will open. So it's open. So they use a forceps to bring it out and rushed him to the hospital. That same hospital. Then they told them that, well, this is what we removed from the patient. And the doctor began to apologize. They said all the hospital bills they've incurred is all on them. Everything is all on them. My point is, should nurses, doctors, pharmacists, any healthcare provider,
we should not be egoistic to the point that we cannot accept our own fault.
No, that's not even my question. My question is, should they get sued? Like, I think it's high time people understand when
negligence and
malpractice is important. And like you said, they shouldn't be their ego shouldn't come
over the patient's will or goodness of the patient.
So what we want to talk about now is medical. Is just a little. It's not. We're not going to elaborate on it.
Yeah.
We want you people. Not you people. We want you at home watching us to give us. Maybe you're at home driving or wherever you are listening
to us.
You give us your opinion or your experiences and share it with us about what you've seen. We want to like get a lot of things from
stories, personal or third person that you are very sure that it really happened.
Yeah.
To send your stories in.
To be able to share and have an episode dedicated to this, whereby I will talk about this. And from my own perspective, when my mom told me that, oh, they've done surgery again, removed it, cleaned it, and given him antibiotics, and this was what the hospital said, medical bill cost, they will cover.
Is that the only thing that has been incurred? It's not just them.
The first thing I said is, sue them!
Of course.
Sue. My mom was like, Nigeria, and I was like, I don't
Doesn't
care.
matter.
Sue them. You
because
get a lot of
this
money.
in Nigeria, people are winning cases. You remember one actress recently that was defamed. She sued the whatever blogger, and then she got 20 million. If you have a good lawyer, sue and get your money.
Exactly, like that.
People are so afraid of the people are like, me Joe, I don't want court problem. I don't want court problem. The court problem is not against you. It is you bringing somebody to court. Yeah. Somebody is defending themselves against the allegation you brought.
Yeah.
You have upper hand.
You put one of the things that are concerned was like you put your life at risk.
Yeah.
Your life was at risk.
Imagine they paid money to the nurse who was coming over to the doctor.
Yeah.
The husband and the wife could not do certain things for many months or many weeks.
Yeah,
they could not live after themselves. They could not live after their family as they should have. There were so many. It is not just about the money that was not be paid. So many other things have been impaired because of the ego and then the decision of the hospital.
So like we said, please share your experiences and let us know. Then one of the other episode would share it. For you to not miss it, turn on your turn on your notification button.
Set reminder for the next episode to be dropped. And then do not forget to like,
subscribe,
share,
and comment.
Thank you very much.
Thank you very much.
And then also, of course, remember your health is your power, it's your future.
And your health is your wealth. Bye. Thank you. See you later.